Hello friends, welcome to Fast Coder 21. As all of us know, most of the coders are trying to enter inpatient medical coding as inpatient medical coders are having the work from home jobs as well as they are getting more salary than the other specialties. So every day I have been receiving messages regarding inpatient live chat scenario. So in today's session, we are going to learn inpatient live chat coding pacemaker system. So pacemaker system coding is the one of the most complex procedure in even in ICD-10 Pcs as well as CPT also. So today we are going to learn ICD-10 Pcs usually which will use in inpatient coding for operative procedures using the one live chat. So today our session name is Inpatient ICD-10 PCS Live Chat Coding Pacemaker. So please watch this video until the end in order to get in-depth knowledge about pacemaker coding in ICD-10 PCS as well as like, comment, share and subscribe if you are visiting for the first time. So if you have any confusion or doubts, please mention in the comment section of this video so that I will clear all your doubts. So before going to code pacemaker live chat, we need to learn few definitions here. First one is we need to understand what is the or what is a pacemaker. So basically a pacemaker is a cardiac device which helps control abnormal heart rhythm. So in order to control patient's abnormal heart rhythms, physician will place pacemaker. So basically this pacemaker uses electric impulses to prompt the heart to beat at a normal rate. So as soon as pacemaker releases electrical pulses, it will prompt the heart to beat at a normal rate. So even this pacemaker controls bradycardia as well as tachycardia and also coordinates the heart rhythm. So next we need to know how many types of pacemakers. So basically we are having three types of pacemakers. Single chamber pacemaker, there we will find only one lead, and we are having dual chamber pacemaker where pace, we will have two leads, as well as biventricular pacemaker where we will have three leads. So most commonly if the patient is having single chamber pacemaker, physician will place pacemaker lead into the right ventricle. So if the patient is having dual chamber pacemaker, most of the time physician will insert or place leads into the right atrium as well as the right ventricle. Whereas in biventricular pacemaker, here we are having three leads. Here physician will place one lead in the right atrium as well as two leads in the right ventricle as well as the left ventricle. So if you want to know the components of a pacemaker system, so we are having one pulse generator as well as the leads. So these leads are based on the lead number. So single chamber pacemaker 1 lead, dual chamber pacemaker 2 leads and biventricular pacemaker 3 leads. Then we need to know why do we need pacemaker. So what is the necessity for pacemakers here? So here in order to control bradycardia, atrial fibrillation, systolic congestive heart failure, cardiomyopathy as well as left bundle branch block and right bundle branch block, physician will use these pacemakers. So basically these are the indications for inserting or placing the pacemaker. Bradycardia, AFib, systolic CHF, cardiomyopathy, left bundle branch block as well as right bundle branch block. So this is the image for pacemaker insertion. So this is single chamber C. This pulse generator is common for every like pacemaker. So however we are having the difference among these lead placements. So first one is single chamber pacemaker. So as all of us know, in heart we are having four chambers: right atrium, right ventricle, left atrium, left ventricle. So total we are having four chambers in the heart. So in a single chamber pacemaker, physician will place lead into the right ventricle based on the patient's condition. Most of the time, this is in the right ventricle, which is here. So if we see dual chamber pacemaker, physician will place two leads in the right atrium as well as the right ventricle. So this is the right atrium, this is the right ventricle, and all these two leads will be connected to the pulse generator, which is common for any type of leads, whether it is single chamber, dual chamber, biventricular pacemaker is same. So if you take biventricular pacemaker, here along with ventricles, physician will place this lead in the LV or left ventricle area. Now we will start learning Icd-10 Pcs live chat pacemaker coding. So here indication for our procedure is complete heart block for management of AV node ablation and atrial fibrillation. Fibrillation. So this is the medical necessity for this pacemaker insertion. So name of the procedure, implantation of biventricular pacemaker and selective coronary sinus venography. So basically here physician is inserting the biventricular pacemaker. So here we need to understand that physician is inserting three leads. As we have discussed previously, biventricular pacemaker consists of leads in two ventricle as well as the right atrium. So we will read the operative report in order to code it properly. So description of report. After informed consent was obtained, the patient was brought to the EP laboratory. So basically EP means electrophysiology laboratory in a fasting non-sedated state. So here patient is not sedated. So that's why they have mentioned non-sedated. So peripheral IV access was established. Prophylactic antibiotics were administered prior to incision. So in order to place our pacemaker generator, physician needs to create an incision. So before creating this incision, physician has placed or provided prophylactic antibiotics. So along with prophylactic antibiotics, physician has provided continuous ECG, blood pressure and pulse oximetry monitoring. And also cardioversion patch electrodes were placed on the patient chest and back. A grounding patch was applied to the skin. Sedation was administered per anesthesia services. So here we need to read a few more uh, operative report lines in order to understand it properly. So next, to define the extrathoracic portion of the subclavian vein and exclude significant venous obstruction or anomalous anatomy, subclavian venography was performed prior to the procedure. So here physician has performed subclavian vein venous venography before placing the pacemaker insertion. Via peripheral IV, contrast was injected and images were recorded. Findings, the subclavian vein and superior vena cava were patent. So by providing or performing the venography, physician has the findings of subclavian vein and SVC were patent. So patent means there is no obstruction in the subclavian vein as well as the superior vena cava. So here is the most important thing we need to understand. The chest was prepped and draped in a sterile fashion. Local anesthesia was injected in the subcutaneous tissue in the infraclavicular area. So infraclavicular means below the clavicle area. An incision was made medial to the deltopectoral groove. So here physician started the incision and the subcutaneous tissue was dissected to the level of the pectoral fascia. So here physician has dissected the tissue until the level of prepectoral fascia. So this is basically fascia level and a subcutaneous pocket was created. So in order to place pacemaker generator, physician has created subcutaneous pocket here. Under fluoroscopic guidance and with the assistance of the images from the venogram, these separate venipunctures were made in the extrathoracic portion of the subclavian vein using a micropuncture needle and modified Schellinger technique. So guide wires were passed and peel away sheets were used to advance the leads into the circulation. So here previously physician has inserted the pacemaker, now he started placing the leads into the circulation. So using fluoroscopic guidance, the leads were positioned. Though the RV lead was advanced to the RV outflow tract, then positioned on the RV OT septum. So basically this is the right ventricular lead and placed in the RVOT septum. So adequate pacing and sensing parameters were obtained. Also one lead placed in the right atrium and attached to PG. So as we have discussed, in a biventricular pacemaker, we are having three leads. So far physician has completed two leads. One is in the right ventricle, one is in the right atrium. So now left is the left ventricle. Next, the LV pacing lead was placed. The coronary sinus was cannulated with a multi-purpose shaped outer CS guide sheath using an AL2 catheter and a hydrophilic wire. Selective coronary sinus venography was performed and an LV lead was positioned in the target lateral branch over an angioplasty guide wire. Adequate pacing and sensing parameters were obtained. So here basically the third lead physician did not pace in the left ventricle. So he is placed in the coronary sinus area. So this is the lead placement in the biventricular pacemaker. So this is the right atrial lead, this is right ventricular lead, and this is the left ventricular lead. It is a biventricular pacemaker. So these pacemaker uh, consists these leads, and these leads will be placed in the heart chambers. So the pocket was irrigated with antibiotic solution and hemostasis was achieved. The generator was connected to the leads and placed inside the pocket. So this is the keyword here. So the pulse generator was connected to the leads. So here we are having three leads. Those three leads are connected to the pulse generator. The wound was closed with two running layers of absorbable suture and medical skin adhesive applied. Following the procedure, the patient was taken to the recovery area in stable condition. There were no complications. So after the procedure, if, we have progress notes contained and discharge note contained. The patient has successful implantation of biventricular pacemaker. So here are the answers for us. So here we need to code four codes. First one is pacemaker generator or pulse generator. Next three codes are for lead insertion. So each and every lead we need to code separately. So now first we will code for pacemaker generator insertion. See guys, we are having the answers here, but seeing the answers you don't understand anything. So here we are going to learn practically. Try yourself first, then use these answers in order to code pacemakers correctly in ICD-10 PCS. So first physician has performed insertion of pacemaker, so it will comes under medical and surgical. So here we need to select this one. So next, so this will comes under J. So what is this one? So based on our documentation, physician has inserted pacemaker pocket in the subcutaneous tissue and fascia. So here we need to select 0J or OJ. Next here root operation we need to select. So basically here physician is inserting inserting the pacemaker in the subcutaneous tissue. So here we need to select OJH. Now we need to select where physician is inserting the pacemaker. So basically based on our documentation, physician is inserted the pacemaker in the chest area. So here we need to select OJH6. So next based on our documentation, physician has inserted cardiac resynchronization pacemaker. So here we need to select this one, cardiac resynchronization pacemaker pulse generator, insertion of cardiac resynchronization pacemaker pulse generator. So basically as per our documentation, physician has inserted pacemaker pulse generator in the subcutaneous tissue of chest area. So here we need to select OJH6078 for insertion of pacemaker. Next we need to code for leads. So again, leads insertions comes under medical and surgical. So here we need to click on O. Next here, physician is inserting leads into the heart and great vessel. So here we need to click on O2. And also here also physician is inserting the leads into the heart. So here we need to click on O2H. And next, first we are going to code for coronary vein. So based on our documentation, physician has inserted one lead in the coronary vein, not in the left ventricle. So here we need to select coronary vein for third lead. So O2H4. Next here we need to select our complete code. So here if you check here, physician has performed. So here we are having the different locations and different operators here, and even we are having the defibrillator also. So based on our documentation, physician has inserted one lead into the coronary vein here. So here we need to code O2H43JZ for insertion of pacemaker lead into coronary vein percutaneous approach for left ventricular coronary vein insertion or coronary vein lead insertion. Next we need to code right atrium as well as the right ventricle. So again here we need to click on O. So as this lead insertion comes under medical and surgical. So again we need to click on so O for medical and surgical. Then we need to click on heart and great vessels as physician is inserting these leads in the heart or heart chambers. Then here we need to choose root operation. So our root operation insertion here. So as we have discussed previously, physician has inserted one pacemaker as well as the three leads. So here also we need to choose 0 2 H, as well as here we need to check the location of the insertion of the lead. So here first the second lead is inserted in the right atrium. So here we need to click on O2H6. Next we need to select remaining three characters here. So this is the code for us. Based on our code description, physician has inserted cardiac lead, pacemaker, cardiac lead. So if you check O2H63JZ, insertion of pacemaker lead into right atrium percutaneous approach. So this is second lead insertion, and we need to code for another lead insertion also, which is for right ventricle. So now we are coding for third lead insertion, which is for right ventricle. So as usual, it comes under medical and surgical. Next here we need to choose heart and great vessels as physician is inserting this lead in the right ventricle. So we need to click on here. So heart and great vessels. Next here physician is inserting the lead. So here root operation we need to take 02H, and here we are looking to code for right ventricle. So here right ventricle comes under O2HK, and as usual we need to choose among these codes for insertion of pacemaker lead into right ventricle percutaneous approach. So like this, whenever we code pacemaker, we need to code three leads insertion along with the pacemaker generator insertion. And as it is a biventricular pacemaker, we need to code pacemaker pulse generator insertion as well as three leads. So thanks for visiting FastCoder 21. So please like, comment, share and subscribe. If anyone looking for same day surgery training, CPC and CPMA certification trainings, please contact using Vincent Medical Coder @ gmail.com. So if you like this session, please click on like button. So it will motivate me to provide more valuable sessions.